name is David Amrakitara, and I am part of the Skills Development Unit of Alameda County Care Connect. Welcome to the live Q&A portion of the COVID Safety and Personal Protective Equipment webinar. I hope you have seen and viewed the pre-recorded video of the webinar, either moments before or at your own leisure. If you're just getting on, please do mute yourself so that we can hear Dr. Laura Miller. If you have any questions, add them to the chat box so that we can avoid 10 folks asking questions at once. However, if you don't have the chat box functionality, do feel free to ask your questions via the phone or your computer. First, let me introduce Dr. Laura Miller, Chief Medical Officer of CHCN, Community Health Center Network, who is helping to train us on PPE. Welcome, Dr. Miller.
Thank you. I'm glad to be here.
Does anyone have any questions for Dr. Miller after viewing that recording? Feel free to put it in the chat function. Go ahead.
Thanks. Yeah, my chat is disabled, so I'm just going to ask.
Sure.
Thank you for the presentation and for being available to us. I wanted to ask about face masks, those plastic shields that go over. Is it a good idea to, not in the clinic setting as much as just in an office or in the work world or in the community, is it a good idea to still wear a mask underneath the face mask?
So it's two different things. There's we usually say the face shield, which is that plastic thing that comes down, and then the face mask, which fits over your mouth and nose. The face shield is really for providers who are doing procedures where they are likely to get sprayed with a lot of secretions. So if I were doing the swabbing, putting the tube or the Q-tip essentially in someone's nose, I would absolutely wear a face shield because they are going to involuntarily gag and send out a lot of secretions on me. But for routine contact, being with people, being out in the world, we're not recommending the face shields.
Can I just ask a quick follow-up to that?
Sure.
Sometimes it gets a little, it's confining to wear a mask. If you kind of want to give yourself a break from the mask, is it, maybe a good idea to wear the face shield then if you have one? No.
No. I mean, it seems nice, right? Because it's sort of like you against the world and you have a lot of nice space, but the problem is that space that you have, right? So yes, it would protect you from stuff coming right at you, but there's all of this space here where things can get in and your things can get out.
Okay,
So,
thank you.
Yeah, I wish there were a better way. I mean, I know that for me, when I take walks in the neighborhood, right, I keep my face mask. I have now this is just me as a human, not as a worker. I have a cloth face mask around my neck that I put up. But if in the work setting, in the clinic setting, I would be wearing probably a paper mask all day. And it's creepy. Yeah, I think we're just going to have to get used to it. Yeah, and I wear glasses, so I've got the whole fogging issue. But again, it's just getting used to it. That's a great question.
Anyone else on the call? Anyone else on the call with other questions? I believe that the chat function is now enabled.
Do you recommend wearing masks while exercising? I would have to look at the public health guidance on this, and I wouldn't want to tell you anything wrong. So I think that is what is being recommended, is to wear a face mask when exercising, but I would have to look it up. I'm sorry. Do you need an N95 if you are not working in hospitals? It's not so much where you work, but what you're doing. So the paper mask is the surgical mask. That is pretty much going to keep your secretions in and protect you from other people's secretions. But if you, for instance, are doing a procedure, you're going to want the N95 where you've actually been what's called fit tested. So for the N95 to really work, it's got to be well fitted to your face. And actually, when providers are getting fitted for their N95s, they wear one and they put on this big giant hood, and that's sort of enclosed, and then smells are pushed into that hood. And if you can smell the smell, you know you're not fit well for the N95. So it really depends on what you're doing. So if your setting is that you are talking to people, not performing procedures on them, then you do not need the N95. Should people consider double gloving? Again, it depends on what you're doing. And in fact, we didn't put a lot of emphasis in the PPE PowerPoint on gloving. I mean, yes, it's important to wear gloves if you are doing sort of a dirty procedure, but really what we're talking about more is keeping surfaces clean and doing hand washing. And I would say double gloving would, yes, only need to be double gloving only for dental procedures. Oh, yeah, yeah. Okay, so I love it. Filters for cloth masks with pockets. All the cloth masks I make have pockets. I have read that coffee filter and paper towel are absolutely fine. It is an added layer of protection. So the mask that I have right now, it does have a pocket in it so that I could snake in some filters, some paper. I actually haven't done it because I'm not in a clinical setting with this mask. I'm in an office setting, but I could put in paper. It really is an added layer. So yes, I think they are effective. They're,
Dr.
and
Miller,
certainly,
what up?
yeah.
Mhm. Dr. Miller, what about cloth masks? How often should I wash these?
I try to rotate them out and have at least two and then throw one in the wash. And really, we shouldn't be touching, you touch a surface, then you touch your mask, you've not done yourself a whole heck of a lot of good. So again, when you're wearing a mask, no matter what it is, try to be really careful about not touching the surface and keeping them clean. But I do think, yes, coffee filters and paper towel are absolutely good items. And it's simply just think about it as another added layer of protection, right?
And so when would they be absolutely necessary for those filters? Under what conditions?
I think really one's own comfort level. And if you are certainly figuring out with your colleagues and those who you are who are supervising you, what is the risk in the setting and what is necessary. I think probably in the shelter setting, I would think that most of you have access to procedure masks. And I can't really comment on cloth masks versus procedure masks. Cloth masks really are for our non-work lives, and leaving the procedure masks for workplace.
Thank you for that distinction.
Yeah.
We also have another question around face masks that are causing acne from long wear. Are there any recommendations to help alleviate this, or should we consider different cloth and material?
What are you going to do? You could be having an allergic reaction to it, although I don't think that's super common. If it's plain old acne, I don't know. Go back to the teenage years with good, good soaps and really good hygiene, and there's probably not a lot we're going to be able to do. Acne is better than COVID. I hate to sound so reductionist, but yeah. Not a lot else. Okay, I normally work in a tiny office for counseling sessions. Even before COVID-19, I could at times see another person's specks of spit in the right light. What about goggles when I return to the office setting? I think you're going to have to think about a different office setting. We're doing a lot of thinking about spaces in health centers, spaces in our offices, and what to do. It's going to have to be different. I don't think you should be in a small, closed, tiny office one-on-one. It's just, no, not a good idea. Not a good idea. I think a lot of counseling, from what I understand, people are having so much success with connecting with their patients on telehealth. The no-show rate is really low. So I think counseling may remain more telehealth based. Now that may not be your setting. It may be that face-to-face is really what's needed, but I would say you would need to be in a much bigger space. Think about outdoor spaces. Again, you've got to balance privacy, right, with it, but a small closed space with another human being, not happening for a while. I had to take a call. Someone fill me in when filters are necessary. I didn't really come up with a hard and fast rule. I think, I made the distinction that the surgical masks, the paper masks, are really work-based. I don't think anybody is recommending cloth masks, homemade cloth masks for the work setting. So I really think filter is sort of one's own decision. I haven't actually used a filter in my own, although all the masks that I make have a space for filter, but that's certainly an option.
Quick follow-up to that, sorry.
Yeah.
So in our office setting, we are using and we was given some cloth masks and are being told to use cloth masks. So in that setting, would a filter be an extra layer?
Yep.
Okay.
Yep. I would up your game. Yep.
Thank you.
Absolutely. And really, paper towels, coffee filters can be super cheap. It does not, I've had people talking about going out and like cutting up vacuum cleaner bags and shop racks, shop cloths. I think a double paper towel is just fine. Again, it's all about, like, if you have gauze that's like this, right? And then you have cotton that's like this, and then you have 2 layers of cotton, and then you put a paper towel in between, you're really building up layers. And that's really what it's about, is trying to keep the virus out.
In terms of surfaces, how often should we be cleaning our office spaces or kitchen countertops?
I think it really depends on your setting. So for me, I'm in an office by myself. Nobody else comes in here. I haven't really done a lot, right? But if you're in a communal space, I think it's important to clean every couple of hours. If you're in a shelter space with a lot of people, I really do think every couple of hours are really important. And thinking about all the other communal surfaces, like door handles, countertops, all of those things.
So in terms of office settings, any thoughts on plastic or acrylic cards for your desks or your tabletops when sitting across with clients?
It's going to be what we're going to need to do. I think we're seeing it. You're seeing it in stores where there's a plexiglass shield. I do think that makes sense. It's going to be really challenging because it feels like we spend our whole lives trying to break down barriers between human beings, right? And here we are saying, yeah, here's a big old barrier between us. Now tell me everything that I need to know to take care of you. It's going to be hard. I think it's going to really rely on a lot of empathic communication skills, but I do think that we are going to be putting up more of those kinds of barriers. Absolutely. And this is something that I think a lot of anybody with an office space is looking at these things. and how to re-engineer the space such that you know, we can do the work that we need to do and be safe. And again, I think we're not going to go to a place where everybody who used to work in the office is going to be there. You know, we have to achieve social distancing. If you're in a really tight space with, say, 6 people, maybe 2 people come in, you know, and the other 4 stay home, and it rotates. We don't really know. Yeah, but we're going to see fewer people in the office. So Jackie's asking everyone, do they have a routine to keep safe from home to work and work to home? Have you any examples, or did what we proposed in the presentation make sense? Was it weird? Did it give you any new ideas? Do you do something better than what we put in there? Because I fully believe there's wisdom in the collective.
Another question while folks are pondering over that is, are there any considerations for having this translated into other languages such as Cantonese or Mandarin?
I do not think there are. I would love to hear what your thoughts are. What kind of audience do you think? Tell me more.
Hi, this is Heidi from Family Bridges. We're trying to prep up for reopening our center. So this goes beyond just, you know, our work, our one program that's working with the unhoused. So, you know, it's a great piece that goes beyond just working with unhoused. And I'd love for our monolingual staff to be able to view it.
Yeah, now I understand. That makes total sense, Heidi. Thank you. I don't know what resources we have or could bring to bear, but I'm certainly honored that you that you want to use it. I'm going to defer that to the team.
So Heidi, I think one of the things we can do is research where we can find translated materials ready. I do know that, for example, UCSF has the materials, particularly around the face mask, translated into several languages. Alameda County Public Health website too has some stuff that are translated. I do know that they are translated into Spanish. However, I would have to check up on some of the other languages such as Cantonese or Mandarin. So we can definitely speak offline, and then I can send you more information, Heidi.
Okay, great. Yeah, I just think that, you know, Dr. Miller just put everything together from the, you know, education around what it is about and what it is, how it is, you know, transmitted or contracted, and then, you know, just all the different steps. And it's all in one nice 40-minute webinar. And it pretty much answers almost every question. So with ease, it doesn't require us to have to pop in a whole bunch of different webinars or little pieces of paper or whatever. But yes, thank you, David.
Yeah, I'm wondering if, I mean, I don't know how we feel about this, but I'm wondering if somebody on your staff could do translation, like take a slide, I speak, and then somebody translates.
Okay, I could bring it back.
I mean, it's putting the work back on you. I'm sorry, but I don't think we have like a copyright concern at all. Like, take it and run with it.
Okay.
Like we could flip it into Spanish because we have Spanish speakers on our team, but no Cantonese speakers. So that I know of. Maybe yeah.
Okay. All right.
And in that sense, too, Heidi and Dr. Miller, we can always do some interpretation or even translation. Someone can do a pre-recorded translation of what Dr. Miller has done, and then do a live Q&A such as this one. So that's another option.
Yeah, and I would certainly be super happy to be on a Q&A if we have a translator. Yeah.
Okay, great. Thank you so much.
Personal. Is hugging a friend okay if you are both wearing a mask? Or should I stick to elbow bump? You should stick to air hugs. virtual air hugs. Basically, what we've got to think about is you want to be in your socially distanced bubble as much as possible. You know, for me, my bubble is my husband, my daughter, and my cat. And those are the people that I hug. And that's it. You know, that's it. At work, you know, we didn't really hug each other at work that much, but you know, we're literally not doing any touching. We're standing you know, a doorway, you know, standing in people's doorways, that sort of thing. Yeah, I know. It's weird. It's just really weird. And I think we have to name the weird or else we'll feel really challenged. I mean, I had a thing last week where there was a death in the family of one of my college-age son's friends, and they all caravan down to you know, support their friend. I couldn't have those kids in the house. I couldn't even have them in the backyard camping because I couldn't have them in my house bubble. You know, I never would do that in non-COVID times. You know, I'd be everybody in the house, bunk them down, make them food, but it just, you know, can't. So yeah, it's hard. It's hard, and we will get through this, but it's hard. Yeah, right. Do you have any suggestions on how to continue to encourage the community to shelter in place? Feel like people are tired of it, so they've started to hang out with friends. I know. I think that really talking about it, naming the tired, you know, I think if we don't name it, it is challenging. So yeah, this is hard. This is hard work, and what we're doing really is saving lives. San Francisco could have looked like New York City, and it doesn't. And part of that is just our timing. We did shelter in place sooner. It has absolutely saved lives. People can be creative. You know, you can sit in a backyard or talk to people in a park with masks on. But it really should be bring your own everything. You know, if you're going to share a meal with somebody, everybody brings their meal and has it on their own plate. You can still, it's weird, you know, but you can still be social, but it's got to be in the COVID context.
Dr. Miller, there's new shelter in place that came out from Alameda County Public Health Department yesterday regarding retails and pickup.
Yeah.
How concerned should I be in terms of picking up packages from, you know, whether it's like Best Buy or any of those retailers?
You know, I think it's probably okay, right? You've got to hope that the people who are making your package at Best Buy are well. You know, and I think a lot of businesses are doing temperature checks of their employees. They are wearing masks. You know, you might want to consider picking it up, taking it home, washing your hands, you know, and then letting it be in your house for a day or two before you unpack it. That would be an extra precautionary measure. I know in my house we're bringing in the mail, dumping it in a box, washing our hands, and then over about 2 days taking, you know, mail from Monday, dumping it in the second box, and on Tuesday dumping it in the third box, and then dealing with it on Wednesday. Super duper cautionary.
Mm-hmm. And similarly, what about takeout and delivery of Grubhub or whatever?
Yeah, definitely. People are doing it. Again, you're trusting that the place that's preparing the food has healthy workers, the transporter has healthy workers. And you know, I think if something can be heated, that's a really good thing. You know, so I would probably take a half-baked pizza over sushi, even though I know what I'd rather eat, which is sushi. But at least I can throw the pizza in the oven, right, and heat it up.
Yeah. One of the things that I've noticed too is when I have taken takeout, you can observe how food staff are handling the food too. So in essence, for me, it's actually easier and it gives me a bit more comfort when I go there rather than when I do delivery, because there's extra changes of hands during the delivery system.
Right, exactly. Again, it's all about risk and, you know, controlling what you can control. Yeah. Somebody, Jacqueline, asked about smell on packages from Amazon. I have no idea. I don't know what Amazon is doing. How about fresh fruits and vegetables? Wash them, wash them, wash them, wash them. You know, just do those things. I mean, I don't think I would bleach my vegetables. I know, you know, back in the day, living in other countries with an unsecure water supply, I would do bleach rinse, you know, a couple of drops of bleach in water. I'm not doing that now. I'm just washing.
Folks, we have about 4 or 5 minutes left. Oh, here's another question that we have. Should we continue to shelter in place even if the economy begins to move into phase 2? One day we hear it'll take weeks, the next day we hear it'll take a few days. It's a little confusing.
Yeah, definitely. It is confusing. But again, shelter in place is not, it's a big term for something that does have a lot of different gradations in it. You know, so we are gradually opening back up with the manufacturing, the curbside pickup. There, on the part of the County Department of Public Health, there are very clear metrics that they need to hit before they can go to the next phases, which include things like level of testing being done and contact tracing being available. So, and, you know, the numbers of cases going down. In Alameda County, we're kind of plateaued in terms of cases. So we're likely to be here for a while. Yep.
We have a couple more minutes. Does anyone have any last minute questions for Dr. Laura Miller?
Well, I do want to do a shout out in gratitude for all the work that you all are doing. I mean, there's a lot of talk about frontline workers, and you absolutely are. And thank you for all the work that you're doing for the vulnerable in our community. It is seen and appreciated. Thank you.
Thank you, Dr. Laura Miller. And thanks everyone for attending this live portion of the Q&A. We'll be sending out this portion so that folks can have access to the recording of this Q&A. We also have sent out an evaluation. I'm hoping that everyone received your evaluation via email. Feel free to talk about how we can improve upon this webinar, but also we ask of you for any additional information or topics that you want to hear and see more about during this time of COVID-19. Thank you all, everyone, and have a wonderful day. Be safe.
Yep, be safe. Take care.
You too. Thank you.
And big shout out to David and Yadiel and Jackie. Woo!
Thank you.
Thank you. Bye, everyone.
Bye.
Bye.